The Col1A2 gene by Alex Benson, Caitlin Morgan, and Morgan Thompson. Ehlers-Danlos syndrome type 3 is a disease causing a defect that affects the veins, joints, skin, and organs. This can be characterized by thin, poorly formed tendons and ligaments, multiple dislocations, and fragile joints and skin. Ehlers-Danlos syndrome is caused by defects in the connective tissue matrix, consisting of fibrillary collagens, fibrillins, elastins, and proteoglycans. Together, these structures provide the mechanical properties of the joint capsule, including the surrounding tendons and ligaments. Collagen is a family of proteins that make up many structures in the body, such as cartilage, bone, tendon, skin, and the sclera, which is the whites of the eyes. To diagnose Ehlers-Danlos syndrome, you would look at the genetic history of the patient, physical signs and symptoms, and run a blood test. During the blood test, you will be looking for markers on the collagen type 1 alpha 2 gene and the collagen type 3 alpha 1 gene.
The collagen type 1 alpha 2 gene is the main gene to cause this disease, which also causes osteogenesis imperfecta. This is known as brittle bone syndrome, which was made famous by the book Handle with Care by Jodi Picoult. The collagen type 1 alpha 2 gene is located on the long arm, which is the Q arm of chromosome 7 at position 21.3. The molecular location of the base pairs are at 94,394,561 and 94,431,232.
This is Caitlin Morgan. Kate is 20 years old and was diagnosed with Ehlers-Danlos syndrome type 3 in July. There is no cure for this disease, but treatments include surgery, physical therapy, braces, and splints. Kate has spent 14 months out of the last 5 years in a shoulder brace. She has had 5 surgeries on her shoulders and needs to have surgery on both hips within the coming year. She has multiple dislocations a day, including hundreds in the last couple of months. Each night she has to sleep with a wedge pillow, a pregnancy pillow that wraps around her body, and 5 other pillows to keep her joints in line. Even with this, she still suffers dislocations to her hips, knees, ankles, shoulders, and collarbones almost every night in her sleep. This is considered a rare disease, therefore there are very few doctors specializing in this. There are only 2 doctors in the U.S. who do specialize, and they take roughly 30 months to get into. We are hopeful that, as more research is done, a cure may be found for this disease.